We're here with Dr. Michael Florack talking about broken bones. Dr. Florack, how does someone know if they have a broken bone or it's just badly injured?
Well, it's a wide range. You might know from the ambulance sirens you hear as you're being transported to our emergency department, or it's the kind of thing that you might not notice for a week or two. It's a pretty wide range of injuries that can happen, from severe life-threatening problems to things that, honestly, if you never told a doctor about, you might be just fine.
You kind of just mentioned this, but it seems common that people don't often realize that they've broken their bone and they maybe end up coming in days later. Can waiting affect the treatment and/or recovery process?
Yeah, it absolutely can. Again, there's a wide range of what can happen, and so some injuries, if you just let heal on their own, will be just fine, but other injuries, if ignored, can be treated totally different, and because of that delay in treatment might mean that the surgery or options that you have is significantly more complicated than it would have been if you sought care right away.
Mm-hmm. And where is the best place to seek care for if you think you have a broken bone?
Yeah, so I think it really depends on the magnitude of the injury. So obviously if you're not able to put weight on something, if you're not able to move something normally, that's something that should be evaluated more quickly and in the emergency department. If you're able to walk, able to move your joints relatively normally, any of our offices or urgent cares would be an appropriate place to work that up.
And what are the most common ways to treat a broken bone?
So usually some kind of immobilization, and the question is that something on the outside like a cast or a splint or a sling, or something on the inside like plates and screws? And it really depends on the nature of the injury, which option is going to be best, and that's something that we go through with patients all the time.
And what is recovery like for someone who's suffered a broken bone?
So again, there's a lot of differences in terms of what can happen. It can be something that's permanent and life-altering, in which case there's a pretty involved course of treatment for at least a few months, or it can be something that after 4 to 6 weeks is back to a full recovery. And figuring out where you're going to be within that spectrum of injury is something that we are able to help people do. My colleagues and I see people and help them figure out what kind of injury they have and what the best approach is to deal with it.
If surgery is needed, what do Prevea orthopedic experts like yourself do in the operating room to ensure the best possible outcomes?
So it involves being careful with every step of the process, and that includes the preoperative decision-making to go to the OR and make sure that someone is optimized and in the best condition they can be based on the timeline of their injury. Getting to the operating room, having an excellent, well-trained, dedicated orthopedic team available with a well-stocked OR, and making sure that they receive excellent surgery that's according to a meticulous preoperative plan and with the most careful hands that can be done to ensure the best possible outcome and safest surgery.
And what does recovery look like after a surgery to fix a broken bone?
So some surgeries can be done outpatient, and you may have an hour-long wait in the recovery room and then go back to your home, and it may be the kind of thing that you spend a few days in the hospital, and anywhere between that would be appropriate.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.